So, Professor Fary Khan, it's a great honor to have you here at the BSPRM annual conference, the president-elect for ISPRM. So, can I ask you your sort of first impressions of the conference? I know that you're here to visit the NRC and you've seen the building as well. So, your impressions on NRC and also your vision for ISPRM's role. A lot of questions, but
Thank you very much, Manoj. Firstly, it's a huge honor to be here to attend the British Society PRM meeting, the annual scientific meeting. So my first impressions are wonderful people. Hospitality is phenomenal and the people are lovely and welcoming. But what really impressed me was how interested the youngsters, the younger trainees are, and the younger consultants are in promulgating the mission of the BSPRM as well as the ISPRM. And there's a lot of enthusiasm in how rehabilitation medicine can be a force to reckon with within the British health system, particularly in light of the WHA health resolution. And of course, we have so much more evidence now that the need for rehabilitation across the planet is so significant. And there's lots of endeavors by the WHO, by the UN Sustainability Goals, and by a number of ISPRM societies, including the BSPRM, in how we can work together more collaboratively to further the agenda for the benefit and better health outcomes for people with disability worldwide. I think from the ISPRM perspective, as the president-elect, I know that our organization there is highly supportive of individual societies in helping them contribute and collaborate with other societies with similar thoughts. The big priorities for us are, for instance, ensuring that there's evidence-based practices for rehabilitation medicine across our member societies. And the need, for example, in Asia Oceania, as you saw earlier in the lecture, was significantly higher than most of the planet. In my view, it's just tip of the iceberg. And we can use that as an example to collaborate and build evidence to strengthen the role of rehabilitation as a value-add service, definitely. Secondly, I think the workforce issues, the gaps, inequity, and the difficulty in finding trained staff and workforce that's flexible and able to deal with anything as in future decades will throw onto us in terms of people with disability, their needs, we need to upskill them. And for that, we need to access the resources put out by the WHO, by the ISPRM, and by all the individual societies, because together we're a force to reckon with. And in my view, using new technologies, particularly AI, for instance, and how it can impact how we deliver services to improve outcomes for our patients with disabilities will really monumentally change the future of rehab medicine and how we deliver it, how we think about it. And I think advocacy within our health systems, with our local governments, given that we had the WHO resolution approved in May of 2023, that's a huge step forward for us as a specialty. But for me, personally, I believe that there are many newer issues that as rehab medicine physicians, we need to look beyond politics and beyond other interests and look at the disabled population across the planet and how we can bring up the more poorer countries, more developing countries into that fold where we support them and we mentor younger societies into becoming more constructive participants and contributors to the ISPRM. And I look forward to seeing what the NRC can do in that context.
yeah, I was going to ask you. So, the NRC's role.
This is my second trip to Nottingham in the UK. And I must admit, the NRC was phenomenal. We were almost jealous. I would have liked to take it back with me to Melbourne, to be honest. But it's phenomenal. The opportunity in how you can restructure your service delivery models of care, break down the silos and how you're integrating all the regional facilities around to become like a hub and spoke model of care. It's very inspiring, I think. But also you have a young workforce. And the NRC has this vision of being a center of excellence in this part of the world. And I believe that will happen definitely with the current enthusiasm and the will of the BSPRM in furthering and maybe showcasing NRC as your magical rehab facility.
Absolutely. So one final question for you. What do you think is the future of the specialty? How are we going to look like in about, let's say, 50 years from now?
I think the future rehab medicine, rehab in general, is very bright. The reason is that we no longer need to prove that we, improve people's lives, improving their function and reintegrating them back to the community. We have sufficient evidence now. This has been acknowledged by the WHO resolution in 2023, which really makes sure that health departments worldwide will conform and support the inclusion of rehabilitation inclusive programs in developing the existing health systems. And secondly, we know that 1 in 3 or 4 people across the globe have a condition that is amenable to rehabilitation interventions. It's a no-brainer. The population is aging. We have better medical and surgical care. People are not dying. They're living with disabilities following cancer, ischemic heart disease, end-stage heart and cardiac failure, and renal failure, and so forth. So there is a role for us to play in every element of the patient's recovery trajectory. So I'm very optimistic, but we just need to hang in there and make sure we advocate for our patients for the best possible care.
Keep pushing for the specialty.
Yes, yes.
Yeah, and can I finally say we are honored, and I think the specialty is honored to have you right in that leadership in ISPRM. So we can't wait to see all the great things you're going to do for the specialty. Thank you so much.
That's very kind of you. It's a teamwork. It's never one person. It's a teamwork. Thank you so much.